everyone, this is our mental health presentation on anorexia nervosa. I'm Olivia Hefner.
I'm Kaylee Perkins.
I'm Sadie Griffin.
I'm Camila Pelt.
I'm Paul Carnasali.
And I'm Izzy Bachknight.
So first we're going to start off with some information about the disorder. This is characterized by some persistent energy intake restriction that's leading to significantly low body weight, and this can be in context of age, sex, developmental path, and also physical health. This is also characterized by a fear of gaining weight or particularly becoming fat, and it's also a disturbance in your self-perception of your weight or your body shape.
Risk factors include occupational choices that encourage thinness or history of being a picky eater, participation in athletics, especially in high elite competition, biological factors that implicate serotonin imbalances, interpersonal relationships that cause the patient to feel pressure to succeed, psychosocial influences such as distorted body image and low self-esteem, environmental factors such as the media's influence to pressure society members to have a perfect body, and temperamental factors such as having anxiety or obsessive traits.
This is assessment and cues. The patient is preoccupied with food and rituals of eating, along with the voluntary refusal to eat. It most often occurs in females from adolescence to young adulthood. Onset often is associated with a stressful life event, such as starting college or university. Compared to patients who have restricting type, those with binge eating / purging type anorexia nervosa have a higher rate of impulsivity and are more likely to abuse drugs and alcohol. The two types are restricting and binge eating / purging, and the comorbidities include depression, personality disorders, substance use disorders, and anxiety. What is the most common population that anorexia nervosa affects? And it's A, older males, B, female children, C, teenage females, D, teenage males. The rationale is C, teenage females, and this is due to self-image, and they're the group most likely to diet.
So these are some expected findings. You'll see some changes in their vital signs such as hypotension, bradycardia, and hypothermia. Their weight is going to be less than 85% of expected normal weight. Some psychosocial changes that you'll see in these patients is low self-esteem, impulsivity, depressed mood, social withdrawal, insomnia, and overwhelming guilt and anger. Some musculoskeletal changes is loss of bone density. Some GI changes that you'll see is constipation, self-induced vomiting, and abdominal pain. Some reproductive changes include amenorrhea and menstrual irregularities, and some integumentary changes that you'll see is lanugo, which is increased to try and insulate the body, and poor skin turgor.
What are some characteristics of a patient with a diagnosis of anorexia nervosa? Select all that apply. A, above average body weight. B, self-starvation. C, intense fear of gaining weight. D, self-induced vomiting. And E, overwhelming guilt and anger. The correct answer is B, C, and E. The rationale is having an above average body weight and self-induced vomiting are characteristics of bulimia nervosa. Self-starvation and intense fear of gaining weight and having overwhelming guilt and anger are characteristics of anorexia nervosa.
Some important findings to pay attention to that may require the patient to visit an acute care treatment facility include less than 10% body fat, unsuccessful weight gain or failure to adhere to therapy in an outpatient setting, vital signs showing a heart rate less than 50 beats per minute, a systolic blood pressure below 90, or a body temperature of less than 96.8 degrees Fahrenheit. ECG changes and or electrolyte changes are important to pay attention to, as well as any psychiatric criteria such as severe depression, suicidal behavior or ideation, family crisis, psychosis, or any other psychiatric criteria that would place a patient at risk for acute care necessity treatment.
So for diagnoses and hypotheses, some labs that we can draw to kind of screen for these things are electrolytes, CBC, liver enzymes, a BMP, and you can also do an ECG on this patient. Some lab alterations that you'll see is anemia, leukopenia, thrombocytopenia, elevated serum creatine, which causes a yellow-orange pigmentation of the skin, metabolic pH imbalances, as well as all of the electrolyte levels are going to be low, which you can see on the ECG. Some screening tools that you'll want to do are an eating disorder inventory, body attitude test, diagnostic survey for eating disorders, as well as an eating attitude test. And these are all examples of secondary prevention.
So some nursing diagnoses include a risk for impaired nutrition. This could be related to decreased caloric intake. This is as evidenced by a weight less than 85% of the patient's expected weight. Also risk for deficient fluid volume related to inadequate intake of food and or liquids. Another one is disturbed body image. This can be related to body consciousness as evidenced by verbalization of the patient's feelings.
So some outcomes and goals that we would expect for these patients is to achieve weight loss stabilization. The patient will do this by eating 3 well-balanced meals each day that include a variety of protein, vitamins, and minerals. And then we'll have another goal of to achieve restoration of weight. The patient will eat foods that nourish the body and follow the plan of care that's developed by the physician and the dietitian. Another goal we have is to eliminate problematic eating patterns. Patient will achieve this by working with the healthcare team to recognize these behaviors and work on reducing them, eventually eliminating them altogether. The last goal that we'd have is to treat the psychological issues and develop a long-term behavioral change for the patient.
For treatment of the disorder and follow-up care, we're going to focus on medications, interprofessional care, and patient education. The primary medication for anorexia nervosa is Prozac, also called fluoxetine. And the provider also might prescribe electrolyte supplementation if the patient is having issues with low electrolytes. As for interprofessional care, the patient will probably be required to visit with a dietitian and a psychologist for cognitive behavioral therapy. The most important part among all members of the treatment team is consistency of care to help the patient maintain on their treatment plan. As for patient education, as the nurse, we're going to assist the patient in creating their own plan for recovery to help promote patient autonomy. All of these are examples of tertiary prevention. The potential complications we're going to look for include refeeding syndrome, bradycardia, severe dysrhythmias, hypotension, and potentially cardiac arrest.
Okay, so next up is management of care. We want to emphasize therapeutic communication with these patients. That involves a lot of active listening, withholding any judgment that you might have, promoting open and honest communication and conversations between you and your patient. And you also want to make sure to equip your patients with the tools that help them recognize and to reframe their maladaptive thoughts regarding food. And as far as exercises, you want to help them cope with their stress and their anxiety, and then working on the need for control that stimulates a lot of these thoughts, and any other interventions that you can do as the nurse to help them.
Question 3, we have which of the following is not an example of an expected outcome for an individual seeking treatment for anorexia nervosa? A, will verbalize understanding of nutritional needs. B, will refrain free from a manic episode. C, will demonstrate weight gain to expected range. Or D, will establish a diet adequate enough to regain weight. The correct answer is B. Manic episodes have no correlation with anorexia nervosa, even though they can be a comorbidity.
Thanks
Thank
for listening,
you.
guys.
Alright, as far as our references go, we pulled some information from Nurse Journal from 2022.
And the majority of our information came from the ATI textbook.